Welcome back to Addiction, Recovery, and Mental Health, a podcast by Waismann Method Opioid Treatment Specialists. I'm your co-host, Dwight Hurst, joined today by Claire Waismann and David Livingston. Hi, guys. Thanks for being here, as always. We have been, of course, talking a lot about awareness. It's within our last couple of episodes, we've talked about perhaps the use of the term poisoning rather than just overdose, and I'm sure we'll get further into that today. But Claire, you had proposed a topic where we talk about those throughout this crisis that are left behind, family members, support systems, partners and family members of those that have died through this epidemic of fentanyl poisoning, and how that's having an effect upon them.
Yeah, because, more and more I'm joining, especially mothers, but families of people that have lost their children or their family members to fentanyl poisoning. And in most cases, again, when we're talking about the poisoning and not the overdose, we are talking about people that really did not have that addiction issue before. People that did try a pill or, borrow the pill, and suddenly the families lose their loved one, and the tremendous trauma that is. Because I think when you are dealing with addiction long term, the risks, you're always scared of that call. But when these families suddenly get a call that their son or daughter or husband passed when they really never had, the addiction issue, I think is a total different story altogether. Not to minimize how any family feels when you lose a loved one. It's just, I think, is a different trauma altogether. And I think it's also important for us to talk about the kids that, due to fentanyl poisoning or overdose, are being brought up by grandparents. Grandparents that are on retirement age, and suddenly they have this 2-3-year-old that, what's going to happen in when they are 10, 15, and 18, and these grandparents are maybe not here anymore to care for them. So I think the long-term tragic effects of the ones that stay behind are something that is not often discussed.
Yeah, there's an element of complexity to trauma nowadays. When they study complex trauma, they find it's more complex when it's surprising. You take tragedy and you add surprise, and that trauma becomes, I don't want to say better or worse than something you had pre-knowledge of, but it's definitely more complicated, right? And you have, as you put it, these single-use deaths, or maybe if not the first time, close to the first time that someone has experimented with opiate or any other kind of drug use, and there's fentanyl in there and they die, right? And so that's surprise right there for everybody. We weren't aware there was a problem. Maybe there wasn't a problem until all of a sudden the problem that ended up taking this person's life. And that's obviously on the increase as well with that surprise element.
Right. So again, I think, when we talk about the opioid crisis, the overdose crisis, the poisoning crisis, all these crises that are stemming from opioid drugs one way or the other, I think the consequences are, so much more extensive and tragic than we are even aware of. And so lengthy. I mean, this is going to cost generations to come.
And that's the thing that people don't always talk about, is that anything that affects kids affects the next generation. And you carry trauma with you into the next generation on a massive level that's going to impact, just a lot of things, right? In society, that's going to start impacting society.
Correct.
Hugely. And if you think about how many, I don't know what the numbers are. We've talked about it in previous podcasts, but I don't know exactly what the numbers are. But over 100,000 people. You look at things that have impacted us in terms of the collective psyche, and you're looking at the profound loss of a generation of young people, primarily, not entirely. It's hitting all generations and all people, but it's significantly younger people, from what I understand. I think shame and not knowing how to kind of talk about it. And I know, Claire, you're in these groups where people are talking about it, which is, I think, great and fantastic. The amount of people I've talked to, young people who will tell me they've lost like 5, 6, 7, 8, 9. I mean, sometimes they'll say, I don't have any friends left. I mean, it's, so, and then, so it's, I don't even know where to start other, I guess that's what we're trying to do here is really sort of bring more awareness, but also, some gravity to, I think that we're slow to act as a culture, right? Especially when because we want things to feel like it's elsewhere. It's not us. It's not our lives. It's someone else's. And that's about as human as anything. And so there's kind of a collective feeling of not wanting to think about it because you don't want it to be in your life, and you don't even want to, it's unthinkable type thing. It's so pervasive, and we see it more than anybody, or as much as anybody.
Yeah. I mean, I don't want to give any wrong numbers. All the numbers I can give is what I read in the internet. But if you figure that on 2020, the overdose deaths reported by the CDC was 56,000, and 21 was 107,000. So it doubled. Imagine this year, it's probably going to double again. There are also some places that you can read that it says that over 170 people a day are dying from poisoning, parenthesis overdose. So I think the numbers are something that I don't think we can even imagine what the real numbers are. And because it's mostly people between 18 to 35 years old. I mean, these are people on the age of, of having young children.
Absolutely. So, yeah, they're the ones who are more likely to have just started. And so you get children who are really likely to be within the first, I don't know, maybe 5 years of life, if we're going to look at it. I'm making up the likelihood. I'm not sure when people are having kids on average now, but, the first 3 years of life, you don't even really remember anything. And then plus that, so you got a whole, bunch of people, enhanced numbers of people in this generation that are growing up with essentially a potential attachment disruption and trauma, right? Along with now a family history of, those problems that come with that.
Correct. And not wanting to go back here to, statistics. For just an idea here, I'm reading here, right here from gregmurphy.house.gov. Fentanyl fatalities, poisons one person in America every 8.57 minutes, killing 175 people every single day. That is huge, guys. Yeah. Huge.
It's staggering.
It's a tragedy. Can you imagine? Almost 200 people dying a day of poisoning of a drug. The consequences of that.
Right.
Imagine if it was a war or a plane going down and all the right, or any,
or street crime. I mean, we'd be rioting, right? Somebody needs to do something about this.
Well, just think of, if you say that a plane is going down every 2 days.
Yeah.
Killing, almost 400 people, they'll stop flying planes right away.
No, it's a fascinating thing to see where people place this, because I remember I grew up in a downtown city area kind of thing, and it certainly wasn't the worst neighborhood in the city that I lived in, but it wasn't the best one either, I guess. And I had friends and associates who lived outside the city and suburbs that they didn't like to come to the city because they were nervous. Now, this is not a high crime city. This is Harrisburg, Pennsylvania. It's a moderately sized city with not much street crime. And just as an example of one of the things that we latch onto, oh, city means crime, don't go there. And that's just an idea of a problem. And so we look at something that's a public health crisis that's going on, and a psychological health, as well as, just the death toll. And we're not looking at it that way as much. I know we've talked before on the show about kind of the over-moralization of these problems. And personally, I think this topic we're talking about today goes right to that. There's certain things that we don't talk about all of the ramifications of as much. And I feel like what is viewed as an overdose is sometimes minimized by saying like, well, that was a person, they took the thing, they took the risk. And we
Correct.
don't talk about like their children and their families and their parents and other people that are affected afterwards.
Correct. And even believe it or not, dealing with all these parents that I'm working with right now, the stigma also for those kids that were in college and got a Xanax from a friend because they couldn't sleep, they were overwhelmed, never did a drug, they were great students, and they died. Mm-hmm. Even to those parents, there's a tremendous amount of stigma because it was, why did your kid took a pill?
Yeah. Well, and especially, I remember growing up and knowing people, family members, or just people you knew that were like, oh, I don't have health insurance. Oh, well, I got some pills left over from my surgery, some painkillers. You got back problems. I mean, or I know a guy who knows a guy, right? I mean, in this day and age too, with lack of access to healthcare, people don't maybe realize that people sometimes get hooked on these things following a surgery, or because they don't have health insurance to get their own prescriptions, and they think they're just getting something. These things happen, and we over demonize it as if it's this is not an excuse to dehumanize people, I don't think, but we have this concept of it's all like people who are willingly taking super risks on the street with street drugs. And, the majority of what we're talking about, how people get into opiates, I mean, they're expensive, right? Some of them. And so it's people of all walks of life, I guess is what I'm trying to say.
Of course. And which kid doesn't take risks?
Yeah, right. That or want to experiment and, and feel, at that age between 18 and 35, most kids feel pretty invulnerable, or don't feel vulnerable. They feel invulnerable. And it's, so, and, historically things have never been this dangerous. And, so it's new territory. And then on top of that, I guess maybe the thing that seems, I think there's a lot of confusion, and maybe this has political ramifications or this or that. I don't really know, but there's confusion between the collective and the individual. And I think what happens right now is there's got to be more of a collective process, and really even I don't understand, why there isn't political pressure on the countries and the places that are making this stuff and bringing it here. I don't understand that. Think about the political pressure we would put on after 9/11. It was, and not, as tragic and horrible as that was, and it was, not nearly as many people are being poisoned or killed as we're talking about, now. It's not even close. But there's no collective will to sort of change it. Maybe there's a feeling of not knowing sort of who or where to go, but I can't believe that entirely.
No.
So but I think a lot of it happens because we go back to the individual. Well, they made a decision. It was a choice. And so it's right. It's kind of like you're saying, Claire, I think if anything, what we're trying to do in this conversation, or what makes sense to me, is we have to have a collective. There needs to be a collective, right?
No doubt. I think us as a society have to, because again, I think there's a combination of guilty parties. Why this has not become why this is not spoken as the tragedy that it really is. Because it's that simple. Is we're gonna need to talk about the open borders, right? And nobody wants to talk about that. B, because it's very easy to blame the victims, because again, they use a drug that was illicit. So I think the combination of both of these factors keep everybody quiet. With We spoke about this on the last podcast, and I keep going back, because for me it's beyond my understanding, with the ability of we have, with the platforms we have, with people on social media all day with their phones in their hands. How come every possible you know technology platform does not create awareness throughout the day that it pops on your phone, with how many overdoses today in New York, how many in California, not overdoses, poisonings, faces of the people. Remember when we had the nicotine, the cigarette commercials on TV?
Mm-hmm. Mm-hmm.
With people dying of cancer, with a lady could hardly speak, with Ben Vereen, with it really moved people.
Yeah.
We are able to do that 1,000-fold,
Mm-hmm.
and we are not, because it doesn't fulfill our agendas. But again, the without going back, I think we as a society have to understand the seriousness of this tragedy, the speed in how it just snowballing, the ramifications to not just the victim but their families. And I think, David, that's where I'm trying to go. I think if we talk about the family, the grandparents, the kids, the parents' trauma, I think if we take the focus a bit of the victims, maybe people will hear. Maybe people will join the efforts. Do you understand what I'm saying?
Yeah, I think that's an excellent way to put this out there. I think that there's an effect by those you mentioned, those who push it away or rather avoid it for kind of well, I guess either malicious or just neglectful reasons. But I think even amongst those that want to help or would do something, I think that nowadays we're so aware of so many different things that we do see some compassion fatigue. And if people don't see a clear thing they can do, then they don't do anything a lot of times. And when you talk about the effects of like grandparents and kids, who especially are the ones affected with the population most at risk, if you're out there and you're thinking, well, geez, what can I do about it? I'm not a drug counselor. I don't know how to prevent, I don't have any friends who I think are using. I do all that kind of stuff. But one thing you could definitely do is when you hear about these things, you hear about someone who's affected by this, reach out to the parents, especially if it's grandparents with kids, or reach out to their kids. Or, if we don't tell our neighbor down the street or that person we go to church with, or that, just that friend of a friend, if we don't go to them and say, hey, you need some help with those kids, or can my kids invite them over to play, or can I drop off some meals here or something? If we don't do it, who will, right?
Yeah, there's even an easier way to help. Retweet. If you see news about somebody that passed, retweet it. Create awareness. Maybe, your neighbor's kid will read it. Maybe your nephew or niece will see your retweet and think about twice before asking for somebody for a Percocet. I mean, there are so many ways to get involved without personally getting involved. And I truly believe the best way to enrich your soul it is helping the next person. It doesn't matter, how extensive that help is. I think if you do it every day, a little tiny, it's the best way for you to feel better. So there is, a payoff in the end result.
Yeah. It's interesting as you say that. I think about all the things I see on social media, but I'll throw myself under the bus. I mean, how many times have I been online, I don't know, standing up for some cause that I believe in, or even just pushing back on something I feel is dumb? Like how many arguments do I get in online when someone says there's too many women starring in the Marvel Cinematic Universe? Or it's just something that is, a thing. But how many times have I then gone, well, I should retweet something important, important in a different way, I'll say, that affects this epidemic of people dying, and you could share some of that.
Yeah, it's almost 200 and mostly young adults daily. Daily. That's a lot.
Right. But I have to think that that the empathy and the compassion, which is that both of you express, and that certainly I feel when I'm talking to people, and I've talked to people who've been devastated by this, young people, like I've said, and it's horrible. But I still feel like there's this collective denial about the size of it, and wherever it's being manufactured, there's a ton of this that's pouring in, and I read somewhere that they did a huge bust somewhere. I don't remember specifically, but it was a massive amount of people, a massive amount of fentanyl. Had that hit the streets, however many people that would have killed would have been, in the thousands and thousands. But imagine if on the television, imagine that you saw governments raiding the facilities in other countries that are manufacturing it, because it's getting manufactured in other countries. And imagine if our government was putting pressure on those countries to figure out who's doing it. And then you got to see that. I mean, that's what happened after 9/11. I mean, it was a statement of such, a collective statement. And I'm telling you, if you saw 5 of those raids or 10 of those raids and so forth, it would change the collective understanding. And then you would get a whole different feeling about it. And then the collective awareness, which really is a collective denial in some way, would shift significantly. So I think individually look, it matters on both ways. I mean, it's funny to hear me talking about this, because in general, I think I'm more oriented towards individual sort of health and responsibility, because that's primarily what I do, and and what I can actually be effective and potentially helping. But I think there's got to be a different collective effort, and I think to some degree both of you must agree, because we are spending, we're doing our podcast to some degree on that idea.
Yeah, but you see, David, it's exactly, and again, I don't want to get political about it. So we know that illicit fentanyl is being produced, starts in China and then sent to Mexico, where they turn it into pills, fake pills. Okay. We know that this last month they found every possible color pill, because now they're trying to reach a younger group of people. We know school's just starting, so why all these colorful candy look-alike fentanyl pills are coming in. So, but in the same hand, what you hear about is the busts. Yes, there are busts, but within the busts, how many people are walking in with fentanyl? If you think that a tiny little pencil point, is a deadly dose, how many people are walking in with a little bag that can kill 20 people, 100 people a day? So again, you're hearing about the bus, you're hearing about the things that are being done, but we are not hearing about what's not. We're not hearing about the deaths, the real number of deaths. I don't want to hear a year from now, because when people hear things that happened last year, it's not so relevant for them anymore because it's past. There's nothing we can do. This is
Right,
something
right.
that we should be hearing daily. How
Well,
much?
That's a great point. I think that because a lot of the studies that we quote, are about a year old because that's how research works. But so when we are retweeting, it's probably good to retweet the current like news stories and like that story of that bust or whatever, and comments that are pertinent to the present.
Correct. So that's what I'm trying to say. So anytime I see a face, because parents are putting the face of their kids on Twitter, I retweet immediately. This is somebody that died yesterday, that died a week ago. I think emergency rooms are able to, expand on how many deaths are coming in, or, police departments. I think, again, but that's out of our control, what's going to be publicized or not, and for what reasons, again, is also beyond our control. I think as people, as a society, we should do what we can to create awareness of what's happening right now. I think we should also create spaces to support, the kids left behind, the grandparents left behind, the parents left behind. I think they are also very important, their stories for us to share. Because, again, I think it will take a bit of the focus of who bought the drug, because it could be any of us, it could be any of our kids. It could be, it's important for people to see that there are more victims than, the ones that use the drug. I think then you're going to get more empathy, maybe. Does that make sense?
I do, I do, but I think it's both. I think you have to, why, yeah, it's kind of, it's mind numbing, but there is a collective denial about this, and I think we're not in denial because we see it all the time, constantly, because we're in the, we do the work of helping people with this, but most people, it's not on their mind. It's not in the media. And even if there's a bust up, I mean, it's, yeah. So I think it has to be both. And so we'll see.
When we talk about the trauma effects on children and families, but especially with the up and coming generation of children who lose their parents, what would we say are some things people should be aware that can happen? As you have a group of people growing up with this trauma and this loss, what are some concerns people should be aware of, that how trauma symptoms are going to carry over into child development, education, the workforce? Any thoughts about that?
They're gonna carry over very badly.
Right. Yeah. Not a lot of pros. Right.
Right. Well, I mean, you're gonna have, for starters, just a ton of broken hearts. I mean, just to humanize it, and it's so specific to each family and each individual, but what you're talking about is families and communities and individuals all being sort of torn apart by it. That we really, really underestimate how much we count on the people around us being there. Even if we don't talk to them all the time, even if we just count on them being okay and in the background. And it isn't until you start losing people that you even know how important it was that they were okay and in the background. And so, I think people's lives get sort of shaped differently. Their internal lives, how they feel about being alive, everything gets shaped differently when you start to have losses.
Yeah, there's been resilience research where they talk about what helps kids to come through things like that. And one of the words that I always think about with that research is the word interested. They say that adults who are interested in a kid will greatly increase that kid's resilience to the trauma that they face, and that even one interested adult can make a huge change in someone's development. And so I often think of that word of like, how do we communicate interest in a child? Obviously, there's people who are teachers or nurses or counselors or, may work with kids professionally. But those of us who, I say that, those that don't work with kids professionally, and just kind of looking out in your life and seeing, when do I run into kids? Do I put myself in a place where I can be supportive, obviously difficult if you don't know anyone directly, but who's been affected by this. But if you hear that story about, so-and-so's kids are now living with their aunt and uncle or their grandparents because they lost their parents to an overdose. If it's someone or a family member, can you communicate interest? I like that word because it feels more actionable to me than just be nice. You know what I mean?
It is the story.
Yes.
People want to be heard, right?
Yes, heard, and it makes them feel validated, their existence validated.
Right, that you have to have something to counterbalance the loss. And interest is a feeling of life moving forward again. And so, the losses are, and if you can't stay identified with the loss or not process it all. If you have someone interested in you and they want you're the best for you, and you can reattach to them, it's some help in sort of combating the other experience and sort of, and I think interest is a great word to sort of talk about how that gets as a catalyst.
It seems to me too that one thing that we can do for people in that situation is, and this goes back to what you said about humanizing, is if we focus on the needs of the family left behind, it becomes more and more important not to talk down about their loved one who died, right? And not to say, oh, well, So those out there that might feel that temptation or that societal norm of talking down about someone who was killed by drug use, don't do that if you really are interested in helping the family, right, that's left behind.
Yeah, it's a combination. I think, especially when you're talking about grandparents caring for kids. I mean, this was a unexpected person that they are going to have to not just financially and emotionally support, but physically support as well. I think, as you said in the beginning, there is a lot that should be done by the administration for these, grandparents, but also that we can do, by again offering sometimes support on things that they don't have, from bed to desks, laptops, whatever, playing with the kids, giving your time, listening to their difficulties, going back to, being able to provide mental health support. It's a shame because I think we don't have even the assistance right now for the patients that are currently using drugs. So we definitely don't have for those that are left behind.
Even if it's just a couple kids and a set of grandparents or other foster family, family members who step in, let's assume 2 parents and 2 kids they're bringing in. That's 4 people who probably need some help, at least 2, maybe 4. So is that, 4 therapists or one really, therapist who helps the whole family? The other thing too is I had a psychologist that I interviewed a while ago said that we're at about a 50% burnout rate for medical professionals, including those in the social services. That those numbers are looking pretty down as far as people who are feeling burned out enough that they're not continuing. So as you put it, not only is there a lack of access to care, a lot of the practitioners of care are taking breaks or burning out too.
We're feeling that in the hospital, the lack of nurses.
Yeah.
You know, a lot of them after COVID retired or actually found other profession. They were just burned out.
So that's another group of people to be nice to. Those in your
Right.
life that. So I should be extra nice to my sister-in-law who's a nurse.
Kindness nowadays goes a long way.
Yeah.
Always has.
Right.
Yeah.
I'm reading here, guys, so you have an idea. Yes, they 250,000 pills. And when I say pills, I'm talking about colorful pills. Pills from smugglers with a candy-like appearance were found in Arizona, coming from Nogales, Mexico. Now, truly, these are pills that look exactly like candies.
Wow,
It's scary.
that's pretty insidious.
So it is here. CBP says could be the start of a new trend where cartels targeting younger users.
The thing that we repress the most in life, whether we know it or not, is death itself. If you look at 9/11, you see 90% of pictures of the planes hitting the towers, or if there's a war going on, you'll see helicopters landing and other things. And the problem with the opioid epidemic and all of these deaths is people don't want to know about deaths. We collectively and individually don't want to think of our own mortality, our friends' mortality, and God forbid, our kids' mortality. So nobody wants to even think about it. It's so big, it's mind-numbing. So much bigger than these other things I've talked about. But in the collective, in terms of the feeling of a society, not at all. I don't know what you do about that, given that that's just kind of a reality of I think how we're all formed, and the repression of death is a useful thing. Because we need to build a life and move forward and feel confident and not feel too anxious and all of that. So it's necessary and useful and helpful. It's not helping with this epidemic. So I don't know what the answer is. I point it out because I always point out these things. That's kind of what I do. I think it's critical to why there isn't actually you're not going to see the news going to 100,000 funerals and putting that on the TV. You will never see that ever, because people don't want to see it. They won't be watched. So this is part of it, because I worry about the empathy. The empathy is critical. It's great, but it's too late, right? The idea is, what do we do to prevent it?
My experience working with young people who have lost someone to overdose, you might think that all of them are turned off to the idea of drugs, but no, they're just a group of kids like any other group of kids, but there's almost a fascination there, right? Because you're going to be fascinated by your parents and their life and their existence. And so sometimes, and then also, how do you treat trauma, right? If you self-medicate, then they're at risk, is what I'm trying to say. There's several reasons why they're in a higher risk to do the same thing. And hopefully that empathy can be provoked to look out for those kids and help guide them away from substance abuse.
Totally. But look, if you tell 100 kids, hey, there's a monster over there in the forest. First of all 100 kids start looking at the forest.
Yeah.
Right. And then you're going to have some of them are going to go over and see what the monster's like and check it out. Some of them won't. And that's just temperamental. It's not necessarily a flaw. It's just kind of certain people have certain, levels of risk tolerance that are just kind of built into them. So some of this is just human nature.
It's truly a tragedy, and is a preventable one, and that's the saddest part of it. It's something that needs everybody's help immediately. Whatever help one can give, if it's to the families, if it's creating awareness, whatever it is, we got to get out of our own selves and our own thoughts, and understand the extent of this tragedy that is going on as we speak at this second.
As soon as one of I am going to say this because why not? As soon as one of the political parties, either one, is certain they're not going to get elected until they deal with this far more intensively, you will have a shift, and that has never happened. And I'm not saying that both parties aren't aware of it and do things about it. And there has been some, changes. There certainly has been some changes, and some of them have been very helpful. But it's actually gotten more dangerous in some ways due to the interventions, and now it has to take on a different. There has to be a different, I think, political perspective. And I'm the last guy who gets into all that. I mean, in general. So, but I really do think so.
Yeah, guys, the easiest thing, again, for anybody listening to this out there, go to Twitter, just put the word fentanyl on your search and you will see what happened the last 24 hours. If, you feel, you are part of the society and, I'm sure you care, just retweet what went on the last 24 hours of fentanyl in this country. And if you do that, twice a week, 3 times a week, I think you're helping out.
And we're going to leave it there for today. Remember, you can follow and retweet and participate in Claire's hashtag Stop the Silence over on Twitter. Always remember to follow us on Twitter at Opiates, or go to the Waismann Detox website at opiates.com to learn more. You can also email us at info@opiates.com. Please send us questions and things that you'd like us to talk about in the program, as well as any questions that you may have. We'd love to help you out. Our music is the song Medical by Clean Mind Sounds. This podcast is a production of Waismann Method Opioid Treatment Specialists and Rapid Detox Center, and also produced by Pop Collar Productions. Go to popcollar.net to learn more about how to start your podcast. For Claire Waismann and David Livingston, I'm Dwight Hurst, and I am here to remind you, as always, that you should keep asking these questions, because if you can find questions, you can find answers. And if you can find answers, you can always find hope. Thanks again for listening. We'll be back with you again soon.